Major changes are arriving on January 1st, and millions of Americans who rely on Social Security SSI and SSDI need to be prepared. These updates will affect monthly check amounts, earnings limits, disability rules, and payment timing. While some changes may increase benefits, others could reduce payments or alter eligibility if misunderstood. The Social Security Administration updates key rules every year, but the January 1 changes for 2026 are especially important due to inflation trends and administrative adjustments. Knowing what's changing before the new year begins can help you avoid surprises and protect your financial stability. The first major update involves the Cost of Living Adjustment, or COLA. Starting with January payments, Social Security, SSI, and SSDI recipients will receive updated benefit amounts reflecting inflation. While the COLA helps protect purchasing power, the increase may be smaller than in previous years. Many beneficiaries expect large boosts after recent high inflation, but slower price growth means a more modest adjustment. Understanding this change helps recipients plan realistic budgets and avoid disappointment when the new checks arrive in January. Another key update affects SSI federal payment rates. SSI benefits are adjusted annually to reflect inflation and economic conditions. Beginning January 1, SSI recipients will see new maximum monthly payment amounts. However, actual payments may vary depending on living arrangements, state supplements, and countable income. Because SSI is a needs-based program, even small income changes can affect benefit amounts. Reviewing the updated SSI rates now helps recipients understand what to expect and avoid confusion when January payments are issued. SSDI recipients should pay close attention to changes in the Substantial Gainful Activity (SGA) limit. The SGA limit determines how much a disabled individual can earn while still qualifying for benefits. Each January, this threshold is adjusted, and 2026 brings a new income cap. Earning above this limit can result in benefit suspension or termination. Many beneficiaries accidentally exceed the limit without realizing it. Understanding the new SGA level allows SSDI recipients to work safely while protecting their benefits. The trial work period rules are also updated on January 1st. These rules allow SSDI recipients to test their ability to work without immediately losing benefits. However, trial work months are triggered by earning above a certain amount. The updated threshold means beneficiaries may use trial work months faster or slower depending on income levels. Misunderstanding these rules can lead to unexpected benefit loss. Preparing now ensures SSDI recipients can explore employment opportunities without risking long-term eligibility. Another important change affects the earnings limit for Social Security recipients under full retirement age. If you collect retirement benefits while working, earning above the annual limit can temporarily reduce your checks. Each January, this limit increases, and the new threshold applies immediately in 2026. Many retirees are surprised when benefits are withheld due to excess earnings. Understanding the updated limit helps working beneficiaries plan hours, bonuses, and overtime carefully. Social Security checks will also change due to updates in Medicare Part B premiums. These premiums are deducted directly from monthly benefits for most recipients. If Medicare costs increase, the net amount deposited into your bank account may rise less than expected, or not at all. Some beneficiaries mistakenly think their benefits were reduced, when in reality, higher Medicare deductions are responsible. Knowing how this change works prevents confusion and helps recipients plan healthcare costs more accurately. Payment timing is another update affecting SSI recipients. When the first of the month falls on a weekend or holiday, SSI payments may arrive early. Starting January 1, 2026, payment schedules reflect updated holiday rules. Early payments can cause budgeting challenges if recipients mistake them for extra money. Understanding the revised payment calendar helps SSI beneficiaries manage expenses and avoid shortfalls later in the month. Survivor benefit recipients will also see changes beginning January 1. Updated COLA adjustments and earnings limits affect widows, widowers, and dependent children receiving benefits. Survivors who continue working must monitor income carefully to avoid benefit reductions. These benefits are often essential for financial security after the loss of a loved one, making it especially important to understand how the new rules apply in 2026. Tax-related changes represent another important update. While SSI benefits are not taxable, SSDI and Social Security retirement benefits may be subject to federal taxes, depending on total income. COLA increases and earnings changes can push some recipients above tax thresholds. This may result in higher tax bills even though monthly checks increase. Planning ahead for taxes helps beneficiaries avoid financial stress during tax season. Overpayment enforcement is becoming stricter, making accurate reporting more important than ever. With updated income limits and benefit recalculations starting January 1, mistakes can lead to overpayments that must be repaid later. The SSA is increasing efforts to recover overpaid benefits. Reporting income changes promptly and reviewing benefit notices carefully helps avoid unexpected repayment demands. People applying for SSI or SSDI in 2026 will be affected by the new rules immediately. Updated income limits, benefit formulas, and payment standards determine eligibility and monthly amounts. Filing before or after January 1 can make a noticeable difference in outcomes. Understanding these changes helps applicants choose the best timing and avoid delays or denials. Representative payees and caregivers must also adjust to the JANU. ERI updates. Managing benefits for children, disabled adults, or elderly family members requires careful tracking of income and expenses. Updated payment amounts and income thresholds mean budgets may need adjustment. Preparing now ensures beneficiaries remain compliant and financially stable throughout the year. State supplements for SSI recipients may change alongside federal updates. Some states adjust their additional payments annually, while others do not. This can result in different total benefit amounts depending on location. SSI recipients should review state-level changes to understand their full monthly income beginning January 1. Digital reporting and online account management continue expanding in 2026. Beneficiaries are encouraged to use online tools to report income, update information, and track payments. While convenient, these systems require accuracy. Learning how to use them properly helps prevent errors and missed deadlines. Budgeting becomes more important as benefit changes take effect. Even small increases can be offset by rising costs for rent, food, utilities, and healthcare. Understanding how the January changes affect net income allows beneficiaries to plan realistically and avoid financial strain. Many beneficiaries mistakenly assume Social Security rules remain static. In reality, annual updates can significantly impact income over time. Reviewing benefit changes each January is essential to long-term financial security. Staying informed empowers recipients to make better decisions and avoid unnecessary losses. In conclusion, January 1 brings 10 important updates that will change Social Security, SSI, and SSDI checks in 2026. From COLA and earnings limits to Medicare deductions and payment schedules, these changes affect nearly every beneficiary. Understanding them now ensures smoother transitions, accurate payments, and greater financial stability throughout the year. Staying informed is the key to protecting your benefits and avoiding costly surprises.